Now, students, shall we start? Are my students getting my voice?
Yes, you may continue. They are listening. Thank you.
Done. Well, Bismillah ar-Rahman ar-Rahim. Today, students, my topic is toxicology. And today we'll take the first lecture of general toxicology. And on 5th of May, inshallah, we will have toxicology 2, in which we will have treatment of poisoning. So today is about general toxicology. You know, basically, the study of poison is coming under toxicology. And the definition says that toxicology is a branch of forensic medicine which deals with the knowledge about the source, properties, characters, and each and everything of a poison is coming under toxicology. In simple words, the study of poison is toxicology. Toxicology, the study. Basically, poison is any substance which, when inhaled, injected, ingested, produces harmful effect to the body, is called a poison. It is any substance which, when inhaled, injected, ingested, produces harmful effect to the body, it is called a poison. So the study of a poison is called toxicology. The good definition says that study of a poison regarding their signs, symptoms, signs what you can see, symptoms what the patient mentions you, fatal dose, the dose enough to kill the person, fatal period, the time required to get person killed, treatment, management, sale, supply, everything of a poison coming under toxicology. So the toxicology is a branch of forensic medicine which deals with the signs, symptoms, diagnosis, treatment, management, sale and supply of a poison coming under toxicology. The poison, as I said, it is any substance which, when inhaled, injected, ingested, produces harmful effect to the body, is called a poison. So one of the version is a poison may be defined as a substance which, when administered in the body, whatever way, it will produce ill health, disease, or a death. There is a very little boundary between a medicine and a poison. The medicine given in a recommended dose with an intention of curing somebody will act like a medicine. In law, real difference between a medicine and a poison is the intention. And the poison is any of the substance given in a large amount in a fatal dose with an intention of killing someone or getting himself killed will act like a poison. I told you, there is a fatal dose, there is a fatal period. The fatal period is the time period enough to get person killed. Maybe it is 1 to 2 hours. Maybe it is like 18 to 24 hours. So the poison, it is given in a larger amount with an intention of killing someone or killing himself is a poison. So there is a very little boundary between a medicine and a poison. Again, medicine, when a substance is given in a recommended dose with the intention of curing somebody, will act like a medicine. And a substance given in a fatal dose or a larger amount with an intention of killing somebody will act like a poison. So there is very little boundary between a medicine and a poison. Like for example, the barbiturate is being given to the patient with an intention of making the person go into sleep, or maybe it is being given for controlling the epileptic fits. You sedate the patient, you make the person lie into sleep, and if it is given in a larger amount, maybe 10, 12 tablets has been taken, it will depress the respiratory center. Maybe it will be used for suicidal reasons. So these poisons are being classified. They are being classified according to the mode of action, which is a very good classification. Like those poisons which stimulate the brain, we call them stimulants. Those which depress the brain, we call them sedative hypnotics. Those poisons which act on any of the body part will create some kind of a sign symptom. We call with their name like a neurotic, so like maybe cardiac poison, like spinal poison. So there is another classification that is called a medico-legal importance classification. In a medico-legal importance classification, the medico-legally, there are few of the poisons which are suicidal in nature. There are few of the poisons which are being given to other person for homicidal reasons. There are few of the poisons which are being taken accidentally. They resemble like any other thing. So they are called accidental poisons. We will talk in detail about it. There are different poisons which are being used for abortifacient reasons to create abortion. They are abortifacient poisons. There are poisons which are being used by a person to kill the infant, and these are called infanticidal poisons like opium drops, etc. So there are two classifications. One is mode of action classification. Other is called medico-legal importance classification. So I hope it's clear that the difference between a medicine and a poison. There is very little boundary between a medicine and a poison. And it is all depending on the intention. So in law, the differences between a medicine and a poison is the intention, why, how, when, where it is being given. So poison is any agent which is sufficient in a sufficient dose or concentration produces injury or deadly effects when introduced into the living system. This is called a poison, and the poison is it. Now, there are a few other classifications of toxicology. And I told you the toxicology is the study of poisons. There is one of the classification called clinical toxicology. Just catch the word clinical. This is a branch which primarily involves the rapid analysis of the drug level in the blood or urine whenever the patient is being received in an ER. You will take the sample. You will just establish a diagnosis. You will take the sample of maybe blood, maybe urine in a living person, and in a dead person, in a mortuary also you take. But clinical toxicology is a branch which involves the rapid analysis of a drug level in the blood or the urine. For example, a snake bite patient reports. First of all, you will decide whether the snake bite has taken place or not. If a snake has really bitten this person, whether the snake was poisonous or non-poisonous. And if the snake was a poisonous snake, you can see the signs. He's giving you the symptoms. You will take the blood and you will send for the analysis. Within no time, within 10, 15 minutes, you will get the report. Maybe the cholinesterase enzyme is high. Maybe the fibrinolysin is high. So this is called clinical toxicology. Second is forensic toxicology. It is establishing the cause of a human death, determining that criminal action has occurred or not quite many times. the dead body has been brought to you. You feel that maybe 16-year-old or 25-year-old boy or a girl cannot die. When you come out from the mortuary, maybe the media people are standing over there and they ask you, sir, what was the reason? What was the cause? We heard like this, we heard like that. So you just tell them, look, it seems it's an unnatural death. It seems it's an unnatural death. But we have taken the visceras, we have taken the contents, and we have sent for the analysis. Unless until we get the report, it will be premature to disclose what has actually happened. But at the back of my mind, I have some idea that that smell was coming. The color of the postmortem lividity was like this. Maybe the body viscerals were all found congested. Maybe the perforation ulceration was there. But we cannot say. In forensic, they say you keep your eyes and ear open and mouth shut. You keep your eyes and ear open, but mouth shut. When we send the visceras or when we send these contents, either we take the blood and we put in a paper, we put some glycerine over it as a seal, we keep in a fridge and we send for the analysis as early as possible. Maybe we take CSF for the, any of the content. Maybe we take urine from the bladder, we take the sample from the stomach, and we send for analysis. After some time, we will get the report, and on that report, we will declare this was the cause. Quite many times it happens that you are being called for exhumation. An exhumation is digging out of a body from the grave for re-examination purposes whenever the foul play is being suspected. Okay. When you go for an exhumation, you know very well you go at an early morning time when throughfare is not there. You get a letter from the magistrate, and there is no time limit for exhumation in Pakistan. In Western world, it is 10 years. You can go for exhumation for 10 years. But I tell you, even after 99 years, you go for exhumation, you get some idea, you get some clue, you get some poison from there. There are few of the poisons which resist putrefaction, or maybe body has been mutilated, or a mutilated body was there, or maybe some kind of skeletal remains are there. You try to calculate by injuries, fractures, contents from the soil, from the body, etc. Anyway, this is forensic toxicology. There is an industrial and environmental toxicology, just like the word industrial. The people working in the factories or the refineries, they get the effect of chemicals on those persons working over there in the industrial plants, big setups, and they are inhaling the fumes for that particular poison in that refinery, maybe tetraethyl lead, maybe some kind of other product, and they develop some kind of a problem because of the exhaust of the gases or the fumes, etc. And you just try to calculate that he's suffering from such and such problem. Radiation toxicology is there. In radiation toxicology, the radiation, the people working in the area where maybe the radiation is there, and if they are being exposed for a longer time period, obviously the proliferating tissues or maybe reproductive system will be getting disturbed. It deals with the harmful effect of the radiation on the human health. Example, I told you that when the radiation is there. There is another way of classifying the toxicology. There is a formal toxicology. There is speculation or speculative toxicology, maybe comparative toxicology, maybe clinical toxicology. Formal toxicology is the study of the different tests you perform, or the test, the safety of poison. These tests are done on animals, whether these things what effect they produce. So this is called a formal toxicology, and this has been done by doing the different tests, and it has been performed on the animals. The speculative toxicology, I tell you one thing before I forget, like maybe we had the industrial or environmental toxicology, a person who was working in the refinery for maybe 18 years time. If he develops some complication, maybe he will sue that company. Maybe he will get compensation for that. And this is called Workman Compensation Act. And you just pay them that he is suffering from such and such problem. We will pay the compensation and he will be removed from the job. Speculative toxicology, it is an attempt to give prediction about the harmful effects. You just predict, and that the harmful effect of poison person will be having out of experimental studies. You get, you suspect or you just speculate that this problem will occur in the people who are working over there. There is a comparative toxicology. It is a comparative study which shows that a substance which proves to be toxic on experimental animals is also toxic for the humans or not. You just compare it and you make a comparative, statement, or it is called comparative toxicology. There is a clinical toxicology, like it is a study of the toxicology of the toxicity of the drugs that are in a clinical practice, like CNS depression causes by barbiturate, etc., in a chronic barbiturate poisoning, or in a chronic, people who are taking for a longer time period, what effects are being produced. Maybe in case of Parkinsonism drugs, that these levodopa, carbidopa, what effects they are being producing on the patient, whether he develops hallucination or illusions, etc. This is called clinical toxicology. I told you that the toxicology in this part of the world, in our country, we classify them according to the two classifications. One is the classification according to the chief symptoms or the sign symptoms, or where they act. If they act on the central nervous system, if they make a stimulant effect like amphetamine, nicotinamide, you can call them stimulants. Those which depress the brain, like maybe barbiturate or a diazepam, that we call a depressant. And a medico-legal classification is maybe accidental, or it is being taken as suicidal, or it is being taken as a homicide. So there are two classifications we follow. And number one, classification according to the chief symptoms. This is one of the classification of the crosses. Maybe the crosses are strong acids, or maybe the inorganic or organic acids are there, or alkalis are there, or vegetable acids are there. Then we have irritants, inorganic, organic, mechanical, like metallic poisons, or maybe the vegetable poison. They are irritants and they make action like that. Now the neurotics. Neurotics, as the name suggests, it is going to affect the brain, affecting the brains or the cerebral. Somniferous poisons are one of the variety. These somniferous poisons are the poisons which relieve pain and induce sleep in the same time. They are the strong or the potent painkillers. They relieve pain and they induce sleep at the same time. And the examples are like opium anisylcholides, like morphine, codeine, pethidine, heroin, dynein, narcotine, and the barbiturate, etc. So these are somniferous poisons. Somniferous poisons, they relieve pain and they induce sleep at the same time. There are few inebriants. This group of poison, they make intoxication, which is characterized by always these drugs, these inebriants, these volatile substances, these drugs. They first make stimulation, then they make narcosis, or they make sedation. So this group of poison causes intoxication, characterized by two symptoms. Number one is excitement. Number two is narcosis. First of all, he will be excited. He will be hilarous, talkative. And if he takes a larger dose, he goes slowly, gradually, after some time into narcosis. And if a person, he is taking a drug, like an alcohol, he keep on taking the dose of the drug, one pack. After some time, he will take another pack. After some time, he will take another pack. So he keep on stimulating the system, and these are the inebriant poison. If the person he takes a larger dose, at the same time, he will land into narcosis slowly, gradually. So the drug, all the drugs of addiction, all these inebriants, they produce excitement and narcosis. The examples are alcohol, ether, ethyl alcohol, methyl alcohol, chloroform, ether, nitrous oxide. You must have heard about a laughing gas, and chloral hydrate or a barbiturate. Like when somebody is laughing and laughing and laughing, and at the same time you start crying. Maybe she's your sister and start crying, then you start laughing. Then you say, "You are crazy? Have you taken some of the laughing gas, or maybe you have taken bhang or something?" So the thing is that these drugs, they are creating excitement, like the chlorohydrate and the barbiturates. There are few of the poisons which are called the delirium poison. And these delirium poisons, as the name suggests, delirium, they produce dreams. And you know, the dreams are the cloudiness of consciousness. When you dream, after some time, you forget about it. So there are few of the poisons which make the person land into dreams or into a delirious state. These are the poisons which make the person cause delirium, like dhatura. And in dhatura, atropine, hyoscine, scopolamine, these are the active principles. We have a cannabis indica. Out of cannabis indica, we take 4 products out of it. One is bhang, majun, ganja, hashish, or charas. In this part of the world, we call charas, but in other parts of the world, it is called the hashish. So these are the drugs which produce or which make a person land into dreams, and these products are being taken by or being given to other person for robbery, kidnapping, pickpocketing, etc. There are few of the poisons which act on the spinal cord. They act on the central nervous system, especially the anterior console of the spinal cord, making exaggerated reflexes like maybe nux vomica, strychnine, the active principle, or jasmium. Second is, there are few of the products like a nicotine, digitalis, aconite, hydrocyanic acid. These act on the myocardium of the heart, and these are called the cardiac poisons, and they affect the heart. And these examples are digitalis, aconite, oleander, nicotine, hydrocyanic acid, etc. There are asphyxiants, as the word suggests, they produce respiratory embarrassment. And when they produce respiratory embarrassment, there are few of the gases which take an entry, and there are few of the gases which are very common. And the examples are carbon monoxide. You must have heard about it, that it decreases the oxygen carrying capacity of the blood. This is carbon monoxide. It is a non-irritant gas. Fatal dose is 60 to 70 milligram per 100 ml. And you have to go for a blood replacement. It's a very fatal kind of, and it is being produced by burning of the organic material, etc. So carbon monoxide is there. Carbon dioxide, it produces oxygen like in the tissue, and person will run for air hunger. There will be either hydrogen sulfide, which is called a severe gas. It makes the paralysis of the respiratory center, and at once the person, he dies because of the paralysis of the respiratory center. The war gases are there, and the war gases, they produce acute irritation in the nasal passage, there are different kind of gases basically, like maybe blister-forming gases, like maybe some kind of a nasal irritants, like maybe some kind of lung irritants, or start sneezing, start coughing. The typical example is a tear gas, and the tear gas which has been thrown on a mob to disperse the mob, and these people, they develop temporary blindness, they develop some kind of a nasal irritation, they develop some kind of coughing, etc. And the typical examples are chloroacetophenone, bromobenzyl cyanide, ethyl iodoacetate. These are the things which are being thrown on the people. So the examples are carbon monoxide, carbon dioxide, coal gas, halogen group of gases, hydrogen sulfide, war gases like phosgene, diphosgene, or these tear gases, etc. There are few of the things which are like curare or conium maculatum, or heavy metals like chronic lead poisoning. They affect the peripheral nerves, and the miscellaneous are food poisoning, mostly due to staphylococcus, and the most dangerous one is the botulinum type of bacteria, and which has been given on second page of your Lipman card. And this Clostridium botulinum is the most dangerous one, and it acts with the acetyl choline. Medico-legal classification. The medico-legal classification is that it can be homicidal, given by one person to other person. There should be a quality of ideal homicidal poison, and it should be cheap, it should be easily available, it should be colorless, it should be odorless, it should be tasteless. The examples are arsenous oxide, mercury chloride, aconite, antimony tartrate, strychnine, insulin injection, etc. These are being given by one person to other person for killing him, with an intention of killing him. These are the poisons used with an intention to kill some other person. And typically in Pakistan, we are having arsenic, which is being given because it is cheap, it is easily available. The fatal dose is very small, 120 milligram to 200 milligram. It does not get, dissolved. It stays on the top. With the first sip, the fatal dose enters inside. The sign symptoms will be like a diarrhea, and the diarrhea will be rice watery type of stools. Maybe the people will think that they have developed some kind of food poisoning, or maybe some kind of diarrhea has occurred, but otherwise this arsenic. But there is one of the disadvantages of arsenic, that arsenic, it resists putrefaction, and it will be available in the body, in the soil for years and years and years. And you take a sample from the sides, 1 pound from the top, 1 pound from the below the body, 1 pound from left and right side, and you send for analysis. There will be traces of arsenic in the soil, and this is called arsenic imbibition. So these are different homicidal poison. There is a quality of ideal homicidal poison. It should be like this. Then we have a suicidal poison. When the person is having tension, anxiety, worries, he will attempt suicide. He don't want to live more. He will try to go for a suicide, and anything available in the house. But in Pakistan, in Karachi, most of the people, they take these insecticides which is available in their houses, maybe some kind of products which are insecticidal type of a product. Mostly organophosphorus compounds are available, because in old days we used to have a DDT, dichloro, diphenyl, trichloroethane. But these days we are not using that. Organophosphorus compounds are coming, and organophosphorus compounds are of two types, alkyl group and aryl group. And there is, they try to go for a suicide, but most of the time they are being saved. So the typical type of suicidal poison will be the barbiturate or sleeping preparations, and they take large amount of dose, and while going to sleep, and in the meantime, they get depression to the respiratory center and die in a sleep, or they go into deep sleep and later they die because of that. Bottle will be available, history will be available, the tension, anxiety, worry history will be there. So the other things are opium, potassium, arsenic, powdered glass for blackmailing reason, kerosene oil, tincture, iodine, etc. These are. There are few stupefying poison to make the person land into such a state that he become like a stupid. And these are the poisons given with an intention of stupefying the poison person and for kidnapping, robbery, pickpocketing reasons. The examples are dhatura, cannabis indica, and its products like bhang, majun, ganja, hashish. And it is also very common between Karachi and Hyderabad, people where their stay is very short. It has been given mixed with a pan, samosa, or a patties, and it has been given where like a railway station, like exhibitions or a bus stops. And when the person, he takes that and slowly, gradually, he lands into such a state and start having muttering type of a hallucination, start taking out thread from his finger. He must have landed into the, such a state when the person can make a robbery or make kidnap. So these are stupefying poison which is being given very commonly in this part of the world. Then accidental poisons are there which resemble any other thing. They are fluid or they are just white. There is no color in it and they resemble like any other thing. Maybe some kind of tablets your grandmother or my grandfather has kept on the bedside, that after my dinner I will take these tablets. Maybe a toddler will go there and will start taking those tablets, and because they resemble like Smarties or maybe the Bunties. So this is accidental poison, maybe snake bite, maybe insecticide, maybe kerosene oil, maybe methylated spirit being taken by the children when it is being kept in a Pepsi bottle or maybe lying behind the door. And when you go in some hideouts or without protective measures, maybe snake will bite the person. These are the examples of accidental poison. There are few of the poisons. There are few of the poisons which are being taken for creating abortion, mostly criminal abortion. And these poisons used to produce criminal abortion. And the examples are the ergot, conine, marking nut, or maybe pituitary extract. These are few of the things which are being given by, and there are two types of these drugs. One is called alcoholics, other is called amylogogus drugs. One of the product which make acute irritation in the GI and reflexively act on the uterus and make the evacuation of the product of conception out. Second is which increase the menstrual blood flow and they make the product of conception grow. Infanticidal poisons are there when in case of a bastard child or an unwanted child, maybe the child will be given some kind of opium drops or maybe mercury or aconite or strychnine, and this is to kill unlawfully a viable fetus up to the age of 1 year, because the definition says infanticide, it is destruction or killing of a newly born viable child up to the age of 1 year is called infanticide. So infanticidal poisons are there, like opium drops is very commonly being used. There are cattle poisons. In an enemy, one of the party will give this poison through their employee, and this is called cattle poisons. And the cattle has got an idea that this kind of a product is harmful. This is a toxic type of a plant. Maybe they will not go near the castor plant. They will not eat that. Maybe they are suspicious about it. They will go and they will smell it. They will just leave it. Maybe when you change the shape, or maybe the castor seeds are being taken and the oil is being extracted out, like castor oil, it is a laxative or a purgative. It has got traces of ricin in it, which enters into the small intestine and convert into ricinoleic acid, which is a severe irritant to the small intestine and make purgation or make a diarrhea. So the dry cakes which we throw out, if the cattle will take that dry cakes, it has got the active principle ricin in it in a larger amount and will have a cattle poisoning. The different other things are maybe sui poisoning or arsenic oxide or mercury chloride. This sui was used in old days. That is with the Abris picatorius seeds. The paste is being made, mixed with onion, dhatura, and spread, and the needles are being made with the finger, dried under the sun. They become very hard. By putting in a wooden block or in a hand, is being hit to the cattle, mostly in a wooden block, so it will create poisoning, just like a snake bite or something like that. There are few properties of ideal homicidal poison. I told you it should be cheap, it should be easy available. You are not going to buy for lakhs of rupees. It should be cheap. It should be easily available. It should be definite in action. The signs and symptoms should resemble to any other disease, and it should be tasteless, colorless, odorless, etc. There are suicidal poisons because the person is already in tension, anxiety, worries. So the questions are there. I'm expecting questions from you. The suicidal poisons, the person is already in tension, anxiety, worries. He don't want to face more problem. He don't want to get jerks. He don't want to get, exhausted because of some reason like fates or something. So the person, he will take that kind of a product which will kill him smoothly, swiftly, effortlessly. So the barbiturate or sleeping preparations are being taken. But unfortunately, people are taking the insecticide, organophosphorus compound. These kind of products are being taken. So I'm expecting questions from you. Today the lecture was of just 40 minutes, and because of Ramadan, we have short lectures. In our second lecture, which will be on 5th of this month, and we will have a treatment and management of suspected case of poisoning, and we will. Is there any question? I'm expecting questions from you. Okay. What is this? As I told you, there are few classifications regarding, there are different angles by which this is being classified. I told you, like a clinical toxicology, you just catch the word clinical, and clinically we just take the sample from the patient. And in forensic toxicology, most of the time in the dead body, we take the samples, we take the viscera, we send for the analysis. Industrial toxicology is one of the questions somebody has asked. I'm coming to that point. Industrial toxicology, or the environment where they have been working for a longer time period, they are ingesting, inhaling, absorbing from the skin. And when the person, he will develop some kind of a complication and it will enter inside. It is a chronic poisoning, so typically chronic lead poisoning in refinery workers, that if he will develop some kind of a permanent problem or disfiguration or some kind of a condition, then the compensation will be paid to him, and it will all depend on the report of a doctor. Same way, the radiation toxicology people working in the radiation environment, maybe they will have a reproductive system manifestation, maybe they will have a blood viscosis type of a thing. Then we have Then we have a formal toxicology. It is the study of the traditional tests. And speculative means when you speculate something, that it is the attempt to give prediction about the harmful effects of the certain poison without experimental studies. You feel that this is a thing which is a stimulant. And if the people who will be working over there, they will develop these sign symptoms. And if they will have more and more and more and more, then their sign symptoms will be like this. Signs, what you can see, symptoms, what he mentions you. So the speculation, you just speculate that you should have when in the kitchen, when patient reports to us in an ER with a severe headache and vertigo and all, we usually ask them, when you were in the kitchen, are you having proper cross ventilation in the kitchen? Because the people, they make kitchen in their houses, there's no proper ventilation, there's no proper cross ventilation, there's no proper exhaust in it. And these days, most of the time the people are, the females are in the kitchen. So you make a speculation. This is what they are trying to say. Then comparative studies being taken, then clinical toxicology is there. I'll submit assignment by today. But sir, we don't have any lecture on mortuary till today. This is Osama Rafi. Basically, this lecture has been taken by Dr. Ramla, and autopsy has been taken in 2 or 3 lectures. So you have to cover, because this will be included in your internal assessments like before. And we have been directed by HEC and our administration from principal office that we have to give you the assignments, and it will be included in your markings. These poisons, these names of the poisons, you are studying pharmacology, and in pharmacology you are going by classification, and you are memorizing. These are the acetylcholine, methacholine, carbapenem, methanol, all you are memorizing. So these are the things, at least you should know the examples of stimulants, you should know the depressant, you should know the narratives, you should know the somniferous poison, you should know the delirium poison, at least a couple of names of each. So we don't have any lecture. We had a lecture on autopsy, and it's all about the mortuary and the postmortem and the types of postmortems, the types of autopsies, aims of autopsies, preservation of the viscera. I think it has been taken in detail by Dr. Ramla from DRMC. Please look into it. You're supposed to learn a couple of names because it will be asked in your BCQs. The abortificant, one of the students, Amna, has asked that what are abortificants? These abortificants are basically, abortion is the expulsion of the product of conception up to any age of the pregnancy. Up to 3 months we call abortion, 3 months to 7 months we call miscarriage, and 7 months to 9 months we call premature labor. This is one of the things done by a skilled abortionist, a doctor, or maybe semi-skilled like a daya or a nurse, or the female herself. These abortion is being created when an unmarried mother, she conceives, or maybe it's a bastard child, or it's an unwanted child. They try to go for an abortion, and criminal abortion is being done by giving few of the drugs. Because we were dealing about the drugs, we are not talking about any instrumentation, we are not talking about or other types, currents, but in case of drugs, there are 2 kinds of drugs. One is called ecbolics, other is called amylobogus drugs, are being taken. One, it makes acute irritation in the GI, reflexly act on the uterus and make the expulsion of the product of combustion out. And second is the one which increase the menstrual blood flow and make it. So the examples are all these pituitary extract or maybe ergot, conine. These are the types which are being introduced by abortion stick inside or by giving orally or by inserting from the, with the help of abortion stick. This is what.
Excuse
Any
me,
other question? Yes.
Professor Mukarram, we need to end the session.
Thank you. We are done. And these are the questions. And I expect all of you to submit the assignment up till today. Thank you very much. We are going to, float another assignment for you. Thank you very much.